So in rest breathing, our diaphragm is going to contract, which is going to pull down our lungs and allow us to inhale air. And when we inhale this air, our volume is going to increase in our lungs and the pressure is going to decrease. And this is going to take about 40% of our air cycle. And then the other 60% of our air cycle is going to be our expiration, which is when the elastic recoil forces within our chest and in our body will take control and the diaphragm is just going to relax and all of the air is going to be pushed out of our body. Now, as we begin to speak, the volume of air must increase in order to increase the negative pressure so that our vocal cords can be blown apart and create sound. Now, because we must control our breathing, we also are going to need more muscles in order to do this. So in our inhalation, not only are we going to use our diaphragm, but we're also going to use our scalenes, our pectoralis minor and our pectoralis major in order to ensure we get enough air in our body. And in our expiration, the recoil forces are going to be controlled by the inspiration muscles, which is going to allow the air to come out a lot slower than it would in typical rest breathing. This is going to take about 10% of our time for inspiration now and 90% for expiration, since speech is created during our expiration. And in order to create the speech, we have to have pressure within our glottis, so subglottal pressure, which is going to be right underneath the vocal cords, and this pressure is necessary in order to create noise and create sound. And we have to rely on our respiratory system to do this because we need the air to create this sound. Now, at some point, there's not going to be enough subglottal pressure to continue speaking, so our muscles are going to completely contract in order to push out the rest of our statement and complete what we have to say.